Another session for us. All right, let's do this. A client at risk for deep vein thrombosis has intermittent pneumatic compression applied. When performing skin assessment, the nurse notices redness over the area of IPC. IPC is intermittent pneumatic compression. Okay, what are the appropriate measures to be taken by the nurse? Select all that apply. Right? So there are 6 things here. Let me know what are the things which you think are good, because we are looking for something good. Okay, whenever you see what are the measures to be taken, look for something good. Now, intermittent pneumatic compression, you might know it as SCD, sequential compression device, and you know the things which we put on the legs of the patients to prevent DVT, or like prophylaxis for prevention of any deep vein thrombosis issue, blood clot issue. We do that for people who are post-surgical. We do that for people who are at high risk for DVT. We do that for people who are immobile because they won't be able to, kind of move much, right? So those are the people. So this is the SCDs or the intermittent pneumatic compression, IPCs, or the sequential compression device, whatever we call it. These little things, which is disposable ones, and they are different sizes. They come in different sizes, right? So these devices can lead to pressure injuries if we put them in the wrong way. And if those sleeves around the legs, if they are squeezing in this area, or the tubing is so close to the ankle area, it is going to make really bad red pressure injuries there, because we should not be putting that tubing thing close to the ankle area. Or if the tubing sleeves are, this is what they call sleeves. These things are called sleeves, okay? And if the sleeves are not the right size, or if they are put in a way and then they change. We are supposed to have this nicely hugging around the legs and the calf muscles, and the pressure, or when there is compression coming from it, it should be happening everywhere in the right way, not just on the ankle area or in one area. And you must have seen people, once they put it on, and then they go for a little walk or went to the bathroom or something and came back, and it's all messed up. It's like all the way down to the ankle, or all the way up, or all the way loose. So those kind of things will add to pressure injuries more and more. So it's very bad. So what are the things we are supposed to do? Make sure we use the proper size. So we have to make sure that we measure the calf circumference and then choose the proper size sleeve. And the manufacturer's guideline will be there, because there are so many types available, and whatever the manufacturer's guideline is, that's what we are going to go with. Okay. And if somebody has a very sensitive, high risk pressure area, like an ankle area, or like malnourished patient, or a baby, those areas where we think that this thing is the tubing is going to kind of press or something like that, we can pad it extra. We don't want the tubing to go into the bony prominences, right? Because it is going to make it worse. It's going to make more pressure ulcer. And we have to use something which has circumferential compression, not single bladder. When we call the thing inside bladder, because just like the blood pressure cuff, I hope everybody know about the blood pressure cuff having a bladder inside, the thing which inflates when we pump the air, the thing which inflates, that is called bladder. The same kind of thing is here too, inside this thing, right? That's how when the air comes, it inflates, because there is a bladder inside. So that bladder, we want it to be all around. There are circumferential compression ones which are available, like 360-degree available. That is better rather than a single one. I mean, there are a lot of ones where it is single, like suppose if this is my leg, right? This is my calf muscle. There may be sleeves which are single bladder sleeves, which means you just put it only under the calf muscle. But the problem with them is just like I said earlier, when the patient walk around or come back or move or position change or something, this thing will shift. The bladder which is supposed to be here, the single bladder which is supposed to be here, it might rotate a little bit and then all the pressure will be here or here, where it's not helping because the calf muscle should be like, should be the one should be compressed more. So better to avoid all those kind of stuff. The better one is to use a 360-degree sleeve rotation, like in this thing, like the pressure goes around, and that's the one which is going to be more helpful rather than on a single point. And we, of course, we need to remove it in between and then assess at least once a day, and most of the time at least once a shift, because we have to do skin assessment every shift, right? So remove it and then do the skin assessment and make sure it is properly, back on the leg so that it can do its work, right? So knowing all this information, let's go back to our question and see if we can get the answers here. It's a select all that apply question. So if you get something wrong, you will have a negative point. So we have to be extremely careful when we try to choose the answers. So we are looking for something good, appropriate. Use a single bladder sleeve. It's not a good thing to do. We would like to have the circumferential one. Keep the patient IPC free for the rest of the hospital stay is really bad. The reason for putting it on is because they are at risk for DVT. So if we keep it off for the rest of the hospital stay, that's not going to be good. They will end up having DVT. That's not okay at all. So no. Then notify the physician to obtain an increase in anticoagulant prophylaxis. No, because this is supposed to do the prophylaxis for DVT. Now, if someone is also on anticoagulant, that's a different situation. But we cannot call the doctor and say, oh, doctor, oh, this patient with compression device is having some redness. So I'm going to take off this compression device. I'm not going to use it for the hospital stay anymore. But you know what? Let's increase the anticoagulants. No, that's not okay because of the high risk of anticoagulant medications, right? We don't want to do that. So this is no. Now, the fourth one is ensure that the device tubing is kept close to the ankles. No, not close to the ankles, away from the ankles because we don't want the things to compress that bony prominence. And then it says use an IPC device with circumferential compression. Yes, that is a good thing to do. And I would say yes to that. And the last one says had high risk pressure injury areas on the leg before applying the IPC. That is also yes. I know things may not look that good now for some of you. It's like stressful. Don't worry. Beautiful things are coming. You will see it. Okay. In my prayers, I love everybody. Take care. See ya.